morning. We're here this morning in the School of Information and Library Science at the University of North Carolina, Chapel Hill with Professor Claudia Gollop. Claudia is also an Associate Dean here in the School of Information and Library Science. Welcome, Claudia.
Thank you.
Let's begin by, why don't you tell us a little bit about the many roles you play here at SILS and at the university?
Well, there are lots of detailed ones that I probably can't even go into all of them. There's so many, but generally myself and the other Senior Associate Dean, Paul Solomon, take care of sort of the day-to-day academic affairs of the school. So that includes, for my part, scheduling many classes, which gets to be a little bit of a challenge, hiring and finding adjuncts when we don't have enough faculty because of whatever research they're doing, or just somehow we need to add more classes. And those are two of the big things that sort of take big chunks of time. Working with students who may have to do some things that are a little different, if they have to take a leave, or if they're re-entering, or they've had some difficulty. And that's sort of the things that kind of pop up. You never know when. Some things are scheduled, some things are impromptu, and you just kind of handle them as they happen. But somebody has to be here to do them, so Paul and I share those duties. So that's part of that administrative deal on academic affairs.
And what kinds of classes do you teach?
Okay, right now, this last 2 semesters, have not been teaching, just sort of working in administration, but generally I teach in the area of reference. So that's the area I came in, a core area. That's one of our required courses here, and it's one of my favorite courses to teach because I think it's sort of the foundation for service work. So that's one. But luckily we have somebody else also who can share those duties, so while I haven't been doing it. The other area that's real important and kind of related to reference is in the health area. So almost anything that has to do with health information, and particularly information for the average person, which is generally called consumer health information. It has all kinds of different little names, patient information, consumer information, but that's the area that I like to work in the most. So I will teach the consumer health information course. I've taught the health information course, which is general advanced reference course in health information. We've added, though I've not had a chance to teach it, called the health environments course, which is a course that for people who might not even think they're interested in this area, look at all the various environments where health information might be used, where you might not think of an insurance company, or you might not think of some other kind of rather unconventional, place like a HR unit. You could still use some of that same information. So, and I think we have what is the other one that we have? Oh, we don't teach, but we also offer. So in this cadre of courses, evidence-based medicine. So, so those are the areas that interest me the most, and where I always lean whenever there's anything going on, and it's ongoing because we always have health issues to discuss. And right now, I'm hoping in the spring when I go back to teach consumer health information or one of the other courses. And another course that I introduced that I don't get to teach as often is information for specific populations, and that's information services for, I pick big groups, but students can pick whatever group they want to pick, but I pick big groups like older adults, which is another one of my favorite groups to work with, and people who are institutionalized, or people for whom English is not a first language, those big groups. But so that, and public libraries. So that's the bailiwick that I like to play in.
It's a big one.
Yeah.
And as you say, very core to this this field. I'll bet you've seen some changes in reference over the last decade or so.
I have, and it's everybody has. Anybody who uses libraries or used to use libraries use them differently. Even if they go in them, they're changed. Even the settings have changed, and I think it's all very good. It all makes sense. because there's so much information. So it shouldn't be one way to get it. Right. So the reference librarian is I think is very valuable now, even more so, because it helps people wade through those people will help people wade through all that information, because there's so much, and folks come in. You may have talked to some other people who mentioned that people come in now with a lot of information. So first you got to get through what they have to make sure, hopefully, that they're on the right track, and then they ask some very sophisticated questions. So they're not sort of asking, I want everything you got on horses. They know a little bit about horses or something, and now they've got to go deeper, and it challenges the professionals. I think it's really been good for public service people, because they are challenged more, so they really actually like the job. I didn't think by this time I would hear people still saying they wanted to be reference librarians or public librarians, but I see a small increase in enthusiasm in that area, so I'm real happy about that.
I see that in my classes as well. People really do want to serve and help people not only find information, but then make intelligent use of it. And your point about sort of the reference interview becoming actually more complicated, I hadn't thought of it that way, but you're right. People sort of come in with either web searches they've done and they have smatterings of bits and pieces, and so it's got to be harder to help them. Yeah,
it is. I think I'm almost in some ways kind of missing it, because that's where I learned a lot of stuff, things I would never ask myself. People come and ask, and then you're forced to kind of learn about what it is they're looking for. And if you like that kind of thing, you kind of get into it, and then you go home with something, new information every day, which is really fun in a way. Don't tell anybody. So.
No, I think we should tell people that it's fun. I had a former colleague who claimed he was a knowledge junkie, and he loved doing reference for that very reason, that he was a learner. He was and he got paid to learn, which is really kind of a special thing.
Yeah, it is. There's an occupational hazard that you get on a track and then you just don't know quite when to stop. But it's true. It's one of those kinds of things. So I think it's good that the reference area, even though it's changed and we're doing a lot of stuff online, and the undergraduate library has chat reference going all the time, and IMing all the time, and we've got NC Knows, and we've got all these digital resources. They only go so far. If somebody has something really complicated, or they're doing a really detailed research paper, or they're really starting on something that's going to go, like a dissertation, it's going to go a while, or a thesis of some sort, you've got to go dig up some stuff that's not available digitally, or you don't know how to find it digitally. And that's where the public service people can help. So I really am just liking the fact that still exists.
That's great. Well, hopefully people will be inspired to continue to go into public service work. I know you've done work in this consumer health area for many years, and it seems fascinating to me that one of the things that we know people search on the web a lot about is health information, either for themselves or their loved ones. Can you talk a little bit about sort of either what you've done in the past, or what you see going on in the field today?
Well, in the past, myself and some colleagues here have kind of just looked at how people get health information, what sources they may use, and very often, I'm sorry to say, it's not the public library, or up to this point it hadn't been the public library, and it makes sense. I talk to people and I wouldn't think to go there, because I know what they have, and it's sort of like general reading and sort of non-medical stuff. But they've been pressed, public libraries in a lot of places, because the people become a little bit more knowledgeable, that they will go there, and so they've been pressed to sort of add things to their collections. But the communication to the public that being the place to go is still not all there. So I'm still trying to look at not only public libraries, but where can people think about going? So you can put information anywhere, and if you let people know it's there, then maybe they'll go there if it's important to them, and health information gets to be important when it's important. So, so that is this kind of stuff I like to do. right now I'm really interested in two things. It's sort of a little side thing to consumer health information, but it has to do with health, and that is the kind of information that is provided by HMOs and health insurance organizations. And I found out that they provide a lot online, but everybody does not have access to online. Well, when I say that, I mean, when I say access, I mean, well, some people just don't have access. They don't have computers, and they don't have. And then other people, it's just not a familiar medium for them to work in.
Right.
So even if you stuck them in front of a computer, they still don't, quote, have access as far as I'm concerned. So it's available, but they're not accessing it the way they might. That's one. And then there's a difference I found in a couple of places where there's a lot of stuff online from a couple of service providers. But for people who don't have access, they're not getting that same information, let's say, in the mail.
Right.
So there's some difference between how much information is getting to whom, and quite often it's people who need the most that are getting it the least, which means down the road care is not on time. So that's really interesting to me. And so I've just kind of been looking at a couple of providers to see and seeing what they're doing and how they're doing it. And it's kind of new. We have to just keep remembering. I saw my first website in '93.
Okay.
So it's not as old as any of the other ways that we always provided information. And while it looks new and flashy and like it's been around a long time, I think they're still working on what to do and how to do it. And it's costly to send out a lot of mail of the same stuff that they put online.
Do you think that people actually sort of trust the information that they would get from an HMO as opposed to, say, going to the Mayo Clinic or the NIH or sources like that?
That's a really good question. I don't know. I think some people, if they're doctors, if they trust their provider that they see in person and they would direct them.
Oh, okay.
Then they have a higher level, I think, that's my assumption, of trust than if they were just coldly presented with something or have some previous negative experience. So it really, I think, depends on the person. But yeah, I think because when I have seen like nurse practitioners who do patient information classes or do programs, they give the impression, of course, that they're caring and the people really pay attention, and then I think they'll follow up. They do adherence better. If they used to call it compliance, I think they changed the term. So I think that's a real good question, and I don't know if anybody has kind of looked at that. The trust. I know people like certain things like MD Consult better than some others and Mayo Clinic than some others. But whether they would trust it and I'm not sure if the information is that different. Because what I saw in a couple of places that there's sort of a couple of organizations that create health information. That's what they do. And they sort of form it out to these different providers under their name. So that's interesting. So, but I'm glad there's a lot of it out there, a lot of stuff online, a lot of ways to look up almost any condition you come up with. Medline Plus is a fabulous resource. And then we have local ones. NLM funded a few. I think they call them Go Locals. We have one, and a few others around the country cropping up so that people can find information related to health in their regions, which is really good. So I'm tickled that there's so much out there that you can find, but it gets to be confusing, and if you're not well up on this, it's overwhelming. It's absolutely overwhelming to just wade through. This one says that, this one says that, and which one do you use? So, but I wouldn't want them to take it anything away.
So are there ways that we can sort of train our students to help people wade through that and make judgments about what's quality information and what's not, and where the best vetted sources are? Well,
I think the evidence-based medicine course is one of those that really works And even learning about evidence-based practice, even though it's not related to health, and that class that we have now gives students and everybody, I think, another way to look at the research behind all of these things that come out. So you had to have a better way, a better understanding of what the research is and how to evaluate it, what level, and introducing them to things like the Cochrane Collaborative and other review systems, so that you just kind of have a good idea. So, you know, even if you read something in a magazine, if it doesn't lead you to anything that you can follow up and verify, it's almost, what do you do with this? You know, a study said this, and this, and then there's no site for who said it, who led the study, where it came from. That kind of leaves you in the dark to do any more, right?
Right.
So I think those classes that talk about evidence-based practice and research help students to evaluate the foundation of where this came from a lot better. Everybody doesn't take that, but I think a lot of people are getting more astute about it, because there's just so many in the media. You know, almost every television show and magazine has a medical editor, correspondent, and so people are just attuned a little bit more, and also, because we've just had other things that people don't trust, they just ask more questions, even if they're not quite sure. They ask more questions than they used to, which I think is good.
Are there, to your knowledge, and this just occurred to me, efforts for public libraries to hook up with health sciences libraries on campuses, especially what you said earlier about the public libraries don't have the really deep resources necessarily. They've been acquiring them, and electronic begins to help somewhat. But have people tried to do that?
Yeah, there have been a couple of cases, and all the names are sort of escaping me now, of the colleges and the public libraries that have done this. But this 2001, there was a joint conference between the Public Library Association and the Medical Library Association, which I did attend. It was a one-shot. I wish they would do it again, because both came together, and there was this sort of discussion about how we can help each other. Hospital librarians weren't quite used to working with, quote, the public. They were used to kind of working with the docs, and the patients went in patient mode, or sort of something like. And public librarians weren't used to working with people who came in with a diagnosis and, were upset. So that was kind of covered, and that kind of thing. That was a really nice conference. In a couple of places, my frame of reference is New York Public Library, when I worked there, had a relationship with the New York Academy of Medicine, which is one of the regional NLMs. And I think it's opened up a little bit now. You used to have to call. If you got something that was too complicated that you, of course, didn't answer, but somebody came in with something, you could call and tell them you had this person who needed something, and could they come down and see you and send a referral slip, and they would go and get an interview there and get some more information about their case if they really wanted to dig into it. I visited them maybe about 7, 8 years ago, maybe a little longer, and it looks like it's a little bit more open. And they were actually doing outreach in the community. So so that was better. It used to sort of be this hallowed hall for physicians and historians and stuff like that. So I think in some other places, relationships like that have occurred. I just don't know how consistent they are. So I'd like to see it be more consistent. Or people just knowing that they could go someplace else. And because when you don't think there's anywhere else to go, then that's not good.
Some people have been talking about sort of the health coach concept, where people are somewhere between a physician. A lot of times these, I think, the model might be nurses who are retired, who then, because so many of us now have multiple physicians, and trying to just coordinate all of this, the information flows between the various medical record systems and our own personal knowledge. And it seems like a kind of an interesting notion, but I wonder if this might also be opportunity for library and information science professionals to establish kind of career paths in which a specialization might be that you're really helping people manage these personal kind of health. Have you run into any of this in your work?
Not formally, no. But I think that's I think that's what some of the nurse practitioners do, and even, I think that's a good possibility. I think that's kind of what they do, and so, or sort of what they do. But I do think that if students graduated with a specialization and kind of understanding this, for example, how the system works, how sort of the healthcare system works, because you just run into all of these little alleys that you're not sure how to navigate. That might be a way to help people just kind of get through the morass of health information and systems issues. So so just like you have some of the people who are like clinical librarians who go and work with teams, go on rounds and sit and kind of listen for or bring information to the team that might answer some sort of outstanding question or outstanding issue about a case.
Right.
They kind of understand how to do that a lot, in some cases, a lot quicker than the MDs themselves.
Right.
How to get to the information that's most current and the most well-researched information. So, I think that's a possibility. I had never thought about that. That sounds like a great job.
You know, we have this new program in health communications with the School of Public Health, SILS, our school, and journalism, and that's more focused on sort of the more classical sort of public information service. But we might want to think about considering this as another kind of track, perhaps.
I'm actually on that, but I haven't done much
as well, and it hadn't occurred to me that might also be another way to go. But what you were saying earlier sort of got me thinking that maybe that would be a possibility.
Well, it makes sense because there's this whole push, it had been a push on health communication.
Right.
And that sort of seems to fall in that bailiwick of how you might use that. There's this thing about patient and doctor communication, and I'm interested in that right now in patient and sort of system communication. Yeah. So there's a lot more control in the system than there is sort of with the MDs and personally. Right. So how do you navigate that? How do you actually understand what the system sends you?
Right.
So I'm really interested in billing.
Oh, yeah.
Good luck to me. I know I'm never going to figure this out.
Right.
But, what is this? It's not clear.
Those codes that map onto words that you don't understand that map onto other sort of technical language.
It's not for the consumer.
Exactly.
It's not for the consumer. And I think it ought to be. A piece of that should be for the consumer. And it was hard to do before, but we know now that technology will allow us to fix that. But I know it's big expense, and nobody's going to spend it, or somebody's going to spend it, because it's going to make sense. Because it's not going to be that expensive soon, I think, to do it. But it is like retro conversion or some big deal that you have to do. But I don't think that at this point somebody should look at a code and see a date and see a abbreviation in 7 months after whatever, not know what the heck went on and why they're paying for this.
Right.
So that's an interest. I'll be in the nursing home before they fix it. I'm sure it'll be a while.
Let's hope not.
Let's hope not.
Are there other things that you'd like to add that come to mind about either the reference area or research related to public outreach and health communications?
Oh, well, I guess it's all sort of in the same ballpark, but I guess the user group would be older adults, which is a really strange term because it covers a huge group, so depending on what you're talking about. But and we have some quote, older adults who are just really way ahead of me in terms of technology and keeping up, and then there are groups that are not,
Right.
and could use some help in getting health information or any information.
Right.
And so that's a group that is of interest, and trying to look at what are they doing now. So I'm just finishing up a master's paper now with somebody who looked at retirement communities in the area and
Right.
what their libraries looking like.
Oh,
And,
great.
And so that's one, and then there are other like community centers and places like that
Right.
for older adults that don't have any of these, and how can we kind of inject ourselves as information folk in there so that they get more steady access to information. I think, again, technology is at the point where now it's not as big a deal as it used to be in terms of foundation wiring and all of that stuff. You kind of just set it up without as much. But it has just not been on their agenda. The agenda was sort of day to day, get whatever we're doing done.
Right.
And so I think that's one of the user groups that I think is, in a lot of ways, the last adopters and then users of all kinds of information, but particularly health information.
Yeah, it's so pertinent to them, and you would think there would be high motivation to actually invest in not just the technology but people, for students to do internships,
Right.
for them to hire librarians who can sort of help in the health area.
Yeah, I think there's got to be some prompting from this end, because it's like any other, quote, public service. They're usually stretched to what they can do at this moment, and if you can't figure out how to show that it will not stretch them any further and more than that, be a benefit, this is not going to be something that's going to just kind of jump on that. There are some places that are really doing things, and I think they're good models. And there's a lot of free stuff out there, so I think that's really good to know. But making it a, quote, program in a place that is not on their list of programs is going to have to be a grant or somebody making it their project to do and showing its success, and then they'll, like anything else.
Well, that certainly is a worthwhile area to both research and develop, and I know our students are very public service oriented, and so hopefully they'll choose to work with older adults and health information, as well as with all the other kinds of services to either children or other kinds of groups, right. or other kinds of information services, whether it be scientific or humanities based. So it's a fun area to be in.
It is. I'm enjoying it.
Well, thank you very much for sharing your thoughts and experience with us, and enjoy the rest of your summer and your impending research and teaching.
Thank you very much, Gary.